All right. Hello, gentlemen. So good to see you both.
Good morning.
Good morning,
Yes, it
guys.
is. Pam,
Matt,
would you do the honors of introducing our guest, our very distinguished guest today?
it is my great pleasure to introduce to all of our listeners and watchers Dr. Manan Shah. And let me tell you guys how I came about meeting this, I think possible genius. Um, It was at our conference, MAC, ICCMO, which again is the crazy acronym for International College of Craniomandibular Orthopedics,
Yeah.
which means it's a bunch of nerds that really want to help their patients out. So we collaborate. And Menon, or Dr. Shaw, was there as he's an ear, nose, and throat doctor, which is an otolaryngologist. Again, nobody knows how to say that or pronounce that. I hope I did okay.
You crushed it. It was perfect.
Thank you, Dr. Shaw. But when I was at that conference, I made sure to listen on his presentation. And what he said, I think is probably the most important take home for me and my patients. Um, to our listeners, one of the biggest frustrations I have as a clinician is helping kids and adults to breathe better. It's hard to get in with ear, nose, and throat doctors. It's hard to get in with allergy testers. And what his company, which is Wyndly, spelled Wyndly, it's on his back and a really professional side.
Beautiful sign. Beautiful sign.
Thank you.
It's fantastic. In fact, it's inspired me. I need my own sign, not a tree.
Yeah.
But anyway, without me going on and on, I wanted our listeners to get to meet you and really and like appreciate how authentic and passionate you are and the product and what I hope is solution that can help so many of our patients and others profoundly. So, Dr. Shaw, tell us about yourself and your company, please. Welcome.
Thank you guys so much for having me. It's such a pleasure to get to connect with you guys. And um, I'm really excited to kind of just connect with people who are in the same sort of space. So I'm an ear, nose, throat doctor or otolaryngologist. We have two practices here in Denver. And one of the things we focus on is helping people breathe. But one of the reasons we love collaborating with providers like you is we focus on helping people breathe through the nose. And it's so important for us to have collaborators like you guys who help people breathe through their, creating the anatomy normally so that the nasal anatomy works. And one of the things we focus on is giving people the ability to breathe appropriately through the nose. The number one cause of nasal congestion is environmental allergies. So 80 million Americans have allergies. That means they obstruct their nose, they have swelling. And we have been taught that the answer is just to take like Claritin or Flonase. And that is fine, but people tend to not realize that if you have bad allergies, it's causing you to breathe through your mouth, and that's going to affect your sleep, it's going to affect the way you feel, it's going to affect your overall health. And so a lot of people just don't know that you can actually desensitize yourself to allergies. People don't realize that there's a way to retrain your immune system naturally so that you don't respond to things like cedar or cats or dogs or dust or mold. And if you can do that, then your nose will be more open, you'll breathe better, you'll sleep better, you'll live better. And so we have a telehealth practice that we see patients all throughout the United States and all 50 states, and we try to help people do that. We do a thing called immunotherapy. It's basically where we expose your body to a small dose of what you're allergic to. And over time, as your body gets that exposure, you start to become desensitized. So it was really fun to come talk to you guys at your conference about this. And I'm really enjoying the opportunity to get to talk to your patients through your podcast about it as well.
Uh, so do this for me, okay? Um, Tell us how this whole concept works, okay? Because I love everything you said, because I don't think people do realize that you can kind of build your immunity to fight against these allergies. Um, Let me ask you, I know some of these answers, but I want everyone to know, does this
Yeah.
work for food allergies as well?
Yeah. There are some techniques that will work for food allergies as well. Because food allergies, there's a slightly higher risk of anaphylaxis. That is something we typically do in a physical office. But for environmental allergies, which is the majority of people, right? Certainly there's a number of people who have food allergies, but way more people in the United States have environmental allergies. And some of those people don't even realize it's affecting their life.
Mhm.
The risk of having something bad happen is so low that we're able to do it with patients via telehealth and sending the medication to their house. And so right now our practice only focuses on environmental allergies, but that's, trees, grasses, weeds. That's dust mite, that's mold, that's cats and dogs. These are all these allergens that some people know they're suffering from them, and some people don't even realize that they should get tested and figure out if they have these problems. But if you're someone who's having like a stuffy nose every spring, or you're taking a bunch of Claritin, or you feel like you're taking Flonase every day, it might make sense to get an allergy test and see if you're a candidate to get treated. Just because you may not want to take those medications everywhere. And so the way this works, it's super simple. Basically, you meet with a physician, we talk to you virtually, we sit down, we understand if you have allergies, we get your history, we figure out if you are a good candidate for our program. If you're a good candidate, just like if you were to come to my office, we'll order you testing, and we have a number of ways to get you allergy tested. One of the easiest ways is we can send you a kit that you can take at home. And then based on the results of that, your doctor will write a personalized prescription for you. Usually we'll use something called allergy drops or sublingual immunotherapy. It's a drop that you take under your tongue. So for those listening audio, it's basically a little vial and you take a couple drips under your tongue. It's a medication that is going to be basically your allergy trigger. So if you have a cedar and a dog and a dust mite allergy, that's what we're going to put into the medication for you. And that daily exposure over time, it retrains your immune system so that it stops responding. Because right now, if you have a cat allergy, every time you see a cat, your nose gets stuffy, runny, your eyes get watery, you just feel miserable. And that inflammation in your nose ends up affecting your ability to breathe through your nose. It affects the way you sleep. And if you work with a neuromuscular provider like these two wonderful people, it's going to affect your ability to use your oral appliance and get those gains in your oral airway that they're working on.
That's 100%. I can't tell you how happy our patients have been because, on this clinical side of things, I mean, you've created this product which has taken a lot of my frustration as a clinician off the table. And my frustration is really for my patient because, when we're trying to get the children's faces to develop correctly, as our listeners and watchers know, the face can't do that unless they have the ability to breathe through their nose. Because if you can't breathe through our nose, we have to open mouth breathe, which makes us have low tongue posture and then poor resting oral facial musculature. So the face starts to develop narrow and or
Yep.
flat.
Yep.
So, I can get, we try so hard to get the kids on boards with, lips together, tongue on the palate, breathe through your nose. But if the kids can't physically do it because they're so congested, there's so much mucosal buildup in their turbinates or their adenoids, we feel for them. So you just said it. It's like they can't even wear their oral appliances as effectively. So we can gain some positive ground, but oh my gosh, the level of success would be that much even better for that human being if they can breathe through their nose, not just for that moment, but long-term success, because we can get the jaw to start to develop and the teeth straight. But again, if they start breathing through their mouth, everything can start to kind of regress. And that's why patients, adults have been in braces or orthodontics not just once at this point, like by their 40s, the third or fourth time, because
Yeah.
they're not looking at the cause, the root cause of the problem.
Yeah.
So for me, when we start talking to our new patients, we talk a lot about our phase one treatment, which is craniofacial or jaw development. So the nose has a huge role in it. So I'm like,
Mhm.
okay, when I look at the 3D scan, I'm looking at swollen turbinates, we're looking at swollen adenoids. So I'm like, okay, we need to get allergy testing on board. I need you to go visit an ENT. And I'm in the DC area. And my God, if these parents, first of all, by the time they can get an appointment and then like figure out how, and you're a dad too, how to
Yeah.
juggle all their like own personal life, professional life, and get that child tested. And then the allergist has to try to communicate with the ENT. And then we have to all try to collaborate. It doesn't happen till months, like six
Mhm.
to 8 months. And so now what we started doing since we've connected and you trained my team on how to get these sample kits. I mean, listeners, it doesn't get any simpler than this. And I want him to explain a little bit of the
Yeah.
science, how to take the samples. It doesn't get any simpler. But then within a 2-week turnaround, they're tested for all environmental allergies and pet, right? Because I
Mhm.
keep pet allergies too.
Yeah.
Then you get a consultation with one of these wonderful doctors within 2 weeks.
Yeah.
And then they're like, okay, yes, you do struggle. This is it. And here's what we can provide to you. Everything comes to your house. So
Yep.
explain to us, please, how is the sample collected?
Yeah. So, one of the things that you mentioned that one of the problems we wanted to solve is it's really hard for people to get access to care, right? The wait times to see our specialty is just super, it's too long. And there are so many sufferers. I heard this great statistic that there are 80 million environmental sufferers according to the CDC, but there are only 4,000 allergists in the United States. Those numbers just don't math. And it's great for me and my colleagues. I mean, I used to practice in Maryland and our practice was always filled. And even here in DC, our practice is filled. But we wanted to figure out a way, how can we use telehealth to increase that access? Because there are providers who live in parts of the country who aren't as busy. And if we can connect those providers using appropriate licensing to patients who are in places that are busy, then patients can get a more convenient experience. And so what we're doing, and it's really easy, is the allergy blood test that we use is incredibly simple. It's a finger prick. You use like a diabetic skin lancet. You prick the finger, and these kits come with all the instructions on how to do it. I could drop it all over myself during the podcast, but it's a sample card. You put some blood on the sample and you send it to a lab. The lab then will test your blood sample for antibodies to those antibodies to see how much it lights up. And that gives us some quantitative information around, are you likely allergic or not allergic? But the most important thing, and this is something I want everyone to understand, allergy is a history-based diagnosis, right? It's not like, hey, we take a test and you lit up to a bunch of stuff and that's what we have to treat you for. No, it's more important that your doctor sits with you and tries to understand, when do you have symptoms? What are your symptoms? What's triggering you? How is this bothering you? And that is what we do. And we're so focused on making sure we listen to the patients. We're not a practice that's just going to stick your skin a bunch of times and say, oh, we're going to treat you for everything because you lit up. No, our point is we try to understand, like, what are you actually allergic to? What's causing symptoms? And we're going to treat you based on your symptoms. And again, we feel like we give patients the option to get treatment in the most convenient way, right? The traditional method for allergy treatment is an allergy shot. And those are great. And we do them in our physical office and they're a wonderful treatment. The challenge for most busy parents and people these days who travel is an allergy shot requires a visit to my office every week. And you have to sit there for 30 minutes afterwards. Now, it is covered by insurance, so that's great, but it's just so inconvenient for patients for years to try to come into my office. And I love seeing them, but it can be a lot. The newer, more modern technique is sublingual immunotherapy. It's a treatment that you take at home under the tongue, and over time that it's the same medications as shots, but imagine how much more convenient it is to just take a couple drops on the tongue every day than to have to go into an office and wait there and park and then wait 30 minutes after the shot and drive home and do that every day. And so we feel like we're giving patients and parents and busy travelers just a really easy way of getting treatment.
So in 1968, I know y'all can't think that I go back that far, but I was number one, I in dental school, number two, married for the first and final time. And I got horrible allergies. I got a stomach ulcer. The stress was just something that I couldn't handle. And back then, there was needles in the back. And I mean, my back looked like a pincushion.
Yep.
And it was horrible experience. Everything that you're saying is so true. And the new technology now is just fantastic. And so we all know, because of the other podcasts that we've done, and Pam's already said, it's absolutely necessary for these kids during the developmental stage. I mean, everybody needs to breathe. But in the developmental stage, if you want to develop the craniofacial, the bones of the face, it is absolutely paramount. So people listening, if you got children that can't breathe at night, if they're mouth breathers, if their nose is stopped up, this is a critical podcast for you to really delve into and do some research on the company Wyndly and help your children, help your family. This is just fantastic. Thank you for being on. And I'd like to say another thing. I mean, this might be historical. I've done a lot of things historical, but for two dentists to have an MD on a podcast and be open and honest with each other is just fabulous. And this is the way that it should be. And we just appreciate you coming on so much.
And we appreciate what you guys are doing, because I think, we all three of us have had this good discussion in real life, but one thing that's so interesting is, in healthcare, we can't all just silo ourselves into our own area. We all have to work together. And so, we know that this is our area, the nose. That's what ENTs do. We love it. But we also know that, like, I didn't train on the teeth and I don't train on the jaw. That's not what I do. Now, of course, you give a tumor, I can take it off, but we need to work together so patients can get developed appropriately, because of our diet and because of just genetics and the way we live and sleep today, a lot of patients are not developing appropriately in that craniofacial way. They're not chewing on, hard food the way we perhaps used to when we developed. And so I think it's so important for patients to know, look, if your airway doesn't develop, not only is it a cosmetic issue, but it's a health issue.
So Pam and I are trained, especially in the TMD, is what you're
Mhm.
talking about. Okay, so few dentists are. Um, it's not taught in dental school. What kind of dentistry was taught in medical school? What did you learn about dentistry in medical school? Absolutely zero.
Not
And
that
people
much.
wonder why they go to an ENT and don't get help. They go to a neurologist and they don't get help. It's
Yeah.
because it's not being taught and we're not talking. And
Yeah.
so I think this
The
is
conversation hasn't started, but I think it's
that's
beginning.
exactly right. Now, I have my book. It's on Amazon. Um, The Life Robbing Pain of TMD. Why me? You got a copy that I gave
Yep,
you at
it's
the
great.
ICMO meeting. So tell me what your thought process went through. I mean, I'm sure you've had patients that had pain in the
So
ear
many. Yeah.
and you
And
checked out the ear and nothing was wrong. You had to go through to protect yourself, protect the patient, go through MRIs and all the unnecessary steps
all the
when it's
stuff.
just a simple referral to a dentist that knows what they're doing. Can you
Yep.
elaborate on that, please?
Yeah. So
From a medicine doctor
one of the
standpoint.
biggest challenges is as ENTs, we see patients with ear pain, right? Which makes sense. And if they have ear infections, but there's sort of this myth out there that all ear pain is an ear infection. And so what happens is these patients have just a really tortured journey. They have pain in their ear. It's probably actually TMD. They go to an urgent care or primary care physician. Those doctors, they have to be able to diagnose so many things. So we can't expect somebody who has to be able to do a heart attack and ear pain and a stroke to know exactly what to look for in an ear in the same way you guys can't expect me to know what to look like in a teeth. And so those doctors, they're doing their absolute best, but they're like, maybe it's an ear infection. So then they refer them to me. Now the patient's seeing their second doctor. And then I come in and I look at their ear. And the challenge for an ENT is we look at an ear and I can tell you in 20 seconds, is that ear infected or not? Right? It's just a very clear, obvious thing. And now I'm in this tough position of being like, actually, you don't have an ear infection. And what that does is it puts the patient in this position of like, well, I just waited 3 weeks to see you. And you're telling me I don't have this disease, but this other doctor did. And it creates this sort of tension, which is so frustrating because now my patient's unhappy. And it's not that I'm not trying to help him, but also my job is to tell him honestly. And like, I can give you antibiotics, but that's not the answer. But what's been really great is again, we're trying to form relationships with providers like you guys who I can say, look, it's not that you don't have pain. And the ear and the jaw are essentially like right next to each other. They're literally millimeters away. And so you do have ear pain, and that's true, but it's not from an infection behind your eardrum. It's from a different cause. And you need to go to the provider or the specialist who's going to be able to fix that problem. And so we've been trying to kind of shift the conversation to like, we're so glad we diagnosed this and we're going to send you to a super specialist, as opposed to the usual, like, you don't have ear pain and your ear looks normal, see you later, which is, I think, one of the problems that used to maybe happen. And so we're super excited to find people who are willing to work with these patients and understand that disease in a more nuanced way. Because if you have bilateral ear pain, it's pretty unlikely that it's just an ear infection that's happening in both sides over and over and over all the time. It's much more likely that you have, jaw pain because the jaw is literally right there and it's on both sides.
So
That,
because of this lack of education, Pam and I made a podcast on how to find the right dentist. So this puts you in a precarious spot too, because you can't just say go see your dentist because your dentist doesn't know any more than anybody else
Yeah.
does. So finding the right dentist in Denver is a challenge. Pam, you have any suggestions on because this is we're really trying to make a difference in this particular situation right here.
Yeah.
Because the dental community and the medical community must communicate and have open dialogue. Pam?
agreed. And actually, Dr. Shaw and I were having this conversation because, you know, like he was just saying, patients get upset with him when he's like, "You're healthy, your ear is fine."
Yeah.
And then he's like, "You need to find a TMJ doc." And then he tries to refer to one, trying to pick one. And then that patient gets even further upset because that dentist has no clue what to do other than
Right.
give him a night guard, which half
Yeah.
the time it makes him worse. And now they're mad at him because he referred him to the wrong doctor. I mean, he's
Yeah. I just spent $3,000 on something that didn't help.
right,
Yeah.
right? So I think something to circle back to Dr. Shaw is like not everybody has the same thought and passion as you do with having this business model where you have the time, you've created an opportunity to have time to actually listen to your patient and
Mhm.
not have like a revolving door of people coming through.
Yeah.
So we need to understand, their history, their story, and then that way we can accurately diagnose the situation and know when it's not something that doesn't belong in our specialty. And then taking it even a step further to take the time to find the right doctors so that we know how to collaborate and help that person. That's not happening nowadays. It's
No,
not,
it's
everyone's too busy. They're in and out, treating patients to codes and dollars and into the
Mhm.
next operatory. Not that
Yeah.
they're ill-intended, it's just
It's
everyone's
the way
so
the system is made. Yeah. And I always joke with patients, your health insurance has incentivized us to see the most of the people they insure, not necessarily to see you in the most time that you need. And so those two things may not necessarily align. And so one thing that's been great is like with our practice here, telehealth practice, we've just changed the model, right? We see patients, we work directly with patients, and we feel like we are able to give them the time they need. I don't feel rushed. It's better for me as a clinician because I don't feel burned out. And it's better for you as a patient because you get the time, you're not rushed. You get to listen, we get to know these patients, especially allergy, right? It's a 3-year course. These are patients who I'm going to see a number of times. We get to know them, we get to know their families. I get to have conversations. I always like learn something interesting from patients because doctors are really siloed in their thing. So I always ask my patients, like, I'm like, hey, tell me something cool about your industry, right? Tell me about, oh, you work on jets? That's super cool. I don't know anything about it. Or you do environmental consulting? Tell me about it. So we love having that experience, but and I think it's been really great to kind of learn from you guys. It sounds like your practices feel very similar. You're specialized in a few things, and that's what you do really, really well. And you have the time to take care of those things really well.
right on.
So let me ask you, I'm retired, so let me ask you a simple question for my 15-year-old beautiful granddaughter who
Yeah.
has allergies.
Yeah.
Okay, so I'm hearing about this. I'm listening to this podcast, and I'm thinking, I want my granddaughter to get this help. So tell me exactly what Mac Lee needs to do to work with your company
Yeah.
and to be able to get her relief.
So we make it super simple. You just need to come to our website and schedule a consult. The first thing we always want to do, what we believe, just like you guys do, that the provider-patient relationship is the center of care. And so you come to our website, wyndly.com, wyndly.com, and you can just click on a button and talk to a doctor and schedule a consult. And so there, me or one of my partners, we have a number of physicians who we work with. We'll sit down with Mac and we'll listen to her. We'll make sure that what she has is something that we think we can fix. Because some patients, will say, hey, maybe the problem isn't, what you think it is. Maybe it's not what we can fix. But if she has a good history, then we'll order the appropriate testing and we'll get her tested, and then we'll go over those test results and we'll take her through the whole journey. And that to me is sort of the way that's how I like doing medicine, right? You get to know the patient, you figure out what tests they need, you understand that data, you incorporate it into their clinical history, and you prescribe them a personalized treatment plan that makes sense for them. That's one of the things we love about immunotherapy is that what the immunotherapy I was on was just cats. That's the only thing that I really had a problem to. But Mac, it might be trees and grasses. And Dr. Marsban, it might be dust and mold. It just depends because you're in DC and it's a swamp. We all know that there's so much like humidity and like I remember when I was in DC, I would come out and after taking a shower and I'd be like, I thought I just toweled down. No, I'm still wet. Um, so depending on the patient, we can tailor that treatment plan to them. So if you're a listener and you know someone who has allergies, which probably everybody does, right? If there's 80 million Americans suffering from environmental allergies, that's 1 in 4 people. Everybody knows someone who's suffering from allergies, and most of these patients don't even know there's another option out there. And that's what we're passionate about letting people know is that you have another option. You don't have to suffer. You maybe don't have to do shots if it doesn't make sense for you. You can do it this other way. And so
Hey,
just wyndly.com.
can I rapid fire ask you some questions as we
Yes,
start?
please.
Okay, because we keep these podcasts somewhat,
Yeah, yeah,
bite-sized
sure.
and quick and clean. Um, how much does it cost to our listeners? How much does it cost to
Yeah.
kind of get the ball rolling?
Yeah, so I think our consultation right now, I'm actually going to check on the website. I believe it's $49, but you would think I would know this. That is done by a business team that I honestly don't even know. Let's see, start with a doctor. We're gonna have to edit this. So, oh yeah, it's $49. So here, let's ask that again.
And what about the
See,
test kit? I
yeah.
think the testing is
So
under 300, right?
yeah, so to meet with a physician, it's about $49. It's super easy. Or if you work with us through one of our providers, the test kit's about, $250 to $300, depending on the provider. We make it super easy. Once you get a consult with our doctor, we charge essentially $99 a month to work with our practice. That includes your medication, your visits,
Wow.
everything. It's just a membership. It's super easy. We've made it so that's literally cheaper than if you're doing allergy shots through insurance, because your copays are going to be more if you're getting a shot every week.
I love you. Don't stop what
That's
you
fantastic. Yeah, that's fantastic.
I am telling you, when I brought this team, they're like, I need to have my kid tested. This kid,
Yeah, we're so excited.
all of
Yeah.
our patients are super excited. We keep saying like, how is this possible?
Yeah.
Another question, do the drops taste bad?
No, well, taste bad there's nuance. They are mixed. It's essentially just pollen and glycerin. Glycerin, if you guys know about it, it's saline or salt water with a little bit of sugar. So they have a little bit of a sweeter taste. But I will tell you, if you're doing certain trees, there's going to be like an earthy taste. And we actually do not put any flavoring in them. One, I'm worried it could affect the efficacy. And two, this is a real medication. And we worry that if we put flavoring in it, it might incentivize a kid or a young patient to drink the whole bottle. And that could be really scary. So this is a medication. You want to take the appropriate dose. Even though it's just pollen and water, if you have an allergy to that pollen and you take a whole big dose of it, you could have a bad reaction. So the key is it's just like a medication. You take your 3 drops every day, you keep it easy.
Is this more, less, or equivalent to getting allergy shots if
Yeah,
the parent or person was going every
of
single
course.
week to
Yeah.
get them right?
Yeah. And so there is not any great study. There's not like a double-blinded placebo-controlled study where someone does drops and someone does shots. But there are indirect studies in the Journal of Allergy, and those studies have found that both methods are effective. And in general, we recommend it's about patient preference. It's about what makes sense. And both methods have been shown to be incredibly effective. We tell patients there's about an 80 to 85% response rate to immunotherapy in either shots or drops, and you have to figure out what makes sense for you. We find that for some patients, shots make sense because if we have Medicaid patients and it's covered by insurance and it's perfect and it's easy. And if they live like within 5 minutes of the clinic, they can come and get their shots. But we find for people who are busy or travelers or people who have needle phobia or kids that the immunotherapy via drops, we see that patients actually finish the program. Whereas with shots, they'll start and it's just too hard to come into an office every week. And so we think that whatever program you're going to finish is going to be the one that's going to be the best for you.
People spend more in coffee a month.
Yeah, I know, than $100 a month. Yeah,
You
yeah,
know?
and we're so excited we were able to get the costs down. Candidly, that was not something we were able to do when it was just my physical practice because the medication costs so much and then the doctor's visits. But now that we've worked with a number of providers and we have providers working with thousands of patients across the country, we're able to negotiate better prices through our pharmacies so we can bring down the prices for our patients and provide more access. Again, our goal has always been to give people access, just like the goal of your guys' podcast is to give people access to this knowledge. We want to give people access to care so that they can feel better.
Mac, is there anything else you want to ask or add?
No, I think this is just fantastic. What do your ENT cohorts say when you tell them that ear pain without an infected ear is TMJ?
They all know it, but I think one thing that since we went to the conference, one thing that they're excited about is the fact that there are providers like you guys who are sort of passionate about this TMJ care, because sometimes we'll have this experience of if we don't know that, a lot of them don't know there's this whole specialty of neuromuscular. And if you send somebody, like you said, to a general dentist that maybe isn't as up to date on it, then the general dentist sometimes almost gets frustrated and they're focusing more on like,
Absolutely.
we've had experiences where we send them to the wrong sort of specialist and that specialist starts looking for cavities and looking for like Invisalign and they're not solving the problem the patient has. It's sort of like if you send someone with a heart attack to me, I'm going to look in their ears, but I'm not going to fix their heart attack. So I think understanding that there are different specialties even within dentistry is such an important thing. In medicine, we give ourselves weird name. Like I'm an otolaryngologist, I'm a cardiologist, I'm a gastroenterologist. But I think we as physicians are not educated enough in the fact that you guys have your own specialties. I think we sort of know there's like orthodontics and there's gen dent, but we haven't done a good enough job of educating ourselves. And so we're doing our patients a disservice, but I think that we're all going to try to change that.
Well, that's
Fantastic.
help us get into your world and
Yeah.
your world. Mac, I've been buzzing up his ear about getting us in one of his conferences. So
Oh, absolutely. Yeah.
Yeah.
help other ENTs understand why your issues can be a TMD issue of itself.
And again, it's not rocket science. I mean,
Rocket science, man.
if
People don't know what
put
they
your
don't
finger in
know.
there and feel the joint. I mean, it hurts. Oh,
Yeah.
it hurts. Okay.
All right,
Yeah.
gentlemen. So, I mean, Dr. Shaw, thank you a million times for taking the time out of your
Yes, sir.
day to
Thank
do
Yeah,
you.
this
this.
has been, and
I
Mac, such a
enjoyed
pleasure. And thank you so
it.
much for your book. It's been
Okay.
so much
Yes.
fun. I've
Can
been
you
trying to
do
like
me
push it
a
onto my
favor?
two partners.
Can you do me one favor? One
Yes.
more
Yeah.
tell our listeners and our watchers how they can connect with you and your
Yeah.
company.
Yeah. Listen, if you know someone who has allergies, who's frustrated with a stuffy nose, runny nose, watery eyes, we make it super simple. You come to wyndly.com, wyndly.com, and you get to just set up for $49 a consultation with one of our providers. We'll listen to your allergy symptoms. We'll figure out if you're a good candidate. And if you're appropriate, we'll order you allergy testing and we'll get you on your way to getting allergy desensitization from the comfort of home. We want to make it as easy as possible for you to breathe better, live better, and sleep better.
Amazing. Thank you so much, Dr. Shaw.
Thank you, sir.
Thank you
Thank you.
guys. Yeah. Guys, Mac, I didn't know you were retired. I love that you're just like lecturing on this stuff.
Oh, yeah.
And
I've got a
yeah,
second career writing.
so
I've got a
cool.
lot of things, a lot of goals to finish before I go.
I was gonna ask you guys, and we can do this later for if you guys got to run, but like I would love to. I wanted to try to cut. Like we've loved this. I didn't even know your guys' specialty was different because there's like Vivos airway dentist, and then there's now neuromuscular, and we've had such a. And the only person who I previously met was Dr. Rahman, and we had a great time. Like me and him just like shot the breeze, but also we like shot the breeze because like his dad and my dad lived a parallel life, um, because they kind of both came over at the same time.
Hmm.
But I would love, I'm going to ping you guys about like, are there any conferences coming up that we can go to? I kind of want to see if my company will send me to Japan, um,
Do.
which would be
That'd
awesome.
be cool. We're both going to be speaking there.
That's
Are you
right.
guys both going? Yeah.
Yeah, we're
So
both
I'm going to see if they can do that. I like soft sold it and they're like, no, dude, you don't get a ticket to Japan. Like we're not that big yet.
I like your
But
angle.
yeah, I was like, I'm gonna meet so many good providers. It's good, like it's good marketing. They're like, we can
They have
find one.
allergies too.
Yeah, well, the problem is they Googled, they're like, it looks like there's one in Phoenix. And I was like, yeah, but that's way later.
There is next year. That's hard. That's the main one that you want to do.
Yeah, my co-founder was like, why don't we do Phoenix? That seems a lot more reasonable for the budget. But are there other ones, are there other conferences you guys are going to nearby that I would love to kind of just because like I really do think there's just this like really there's this huge gap in the field for patients between this correlation between airway and ENT. And guys, we've all had this experience. I don't want to like on the podcast knock on dentists because there's my mom's nest. But
We're
one of the
open
problems we're
about
having,
everything here.
yeah, one of the problems we've had in Denver, and I suspect maybe everywhere, is there's a lot of like sort of PE backed dental practices, and they just have like a very different vibe sometimes than the sort of general dentist practice that I grew up with, where it was like me and my dentist, and I knew them, and like I had time. And so some of these sort of like I don't want to name them, but you guys all know them. These sort of like franchise dental places. It's very much like an in and out. Like it feels like fast food, right? And it's fast dental, and it's probably incredibly profitable. And I'm sure it's great for the investors. And I think there's a place for that. But what happens is we make the mistake of sending our patients there. Exactly like you said, they come back to me and they're like, "Why did you send me there?" And we're not telling people to go to places. We're just like, "Oh, go to your dentist." But like if that's their dentist because it's close by and it's convenient they're not going to get the treatment they need. And so I think it's been really fun for me to sort of think about this of like, there's just like totally, just like there's an urgent care for medicine, sort of there's like the dentist in a box places, but that's going to be good for like a quick antibiotic, but it might not be good for a bigger problem. And patients need, do you guys have a registry like on your website? That would be actually, maybe ICMO has it. Like we have a find an ENT on the Academy. Do you guys have one like that to find a neuromuscular?
We have
Yes.
a search engine on ICMO. And again, ICMO is a membership organization, so that
Yeah,
doesn't mean they've been vetted. So
got it.
there's problems there too.
Yeah,
Everything
yeah,
you're saying is 100% true. So when you have a third party payer like insurance, then they become the patient instead of the patient being the patient.
Mhm.
And so we have a podcast of why neuromuscular dentistry or TMD treatment is so expensive. And it's
Mhm.
about everything that you talked about. It's just reality. We're opening it up here and we're telling the truth. We'd
Yeah.
love to be able to do TMD treatment like you've done with allergies, but that hadn't been figured out yet.
Well, the
It's
lab
Pam's job.
costs are so expensive,
Oh,
right?
there's
That's the
and
challenge.
lab afford the time, the training in your team. Um, what I don't think if I don't know if you know this, Dr. Shaw, a lot of listeners won't know this either. Our profession has completely changed and not in a good direction. It was like 10 years ago starting to become a lot more corporate owned, where
Mhm.
you have these group of investors that essentially hire dentists.
Yeah.
And those are offices that are going to be like mills, high volume, quick turnaround.
Yeah.
And I'm not going to poo-poo that either. Everybody has their own business model, and
Yeah.
I'm not the right fit for everybody. But after COVID, I want to say about 90% of our profession is there now. Okay,
Yeah.
there's very few
That
that
the
are,
independence
I mean,
left.
my office is like called a unicorn practice. That's
Yeah.
sad because 25 years ago when I started practicing, that wasn't the case. So not only is it upsetting patients because, patients go there because they want to utilize their insurance benefits. I understand that, no problem. But then, they're not listened to, they're not treated well. Sometimes they are again treated more like procedural codes and dollars. But aside from that, it's burning out our teams
Mhm.
because they hire the assistants and hygienists in front office, promise them a ton of money and then work them like rented
To the
mules,
bone. Yeah.
like 12-hour days. And then they
Yeah.
come out wanting a lot of money, but like less time. It's not great right now, but
Yeah.
you can manage things within your practice, which is what
Mhm.
I try to do and what you're trying to do and Mac did. And, for us, it's about patient care. We'll figure out the business side of it on our end.
Yeah.
And we're not going to be for everybody. People
Yeah.
have got to want our treatment. They have to have the time and the money to afford it too, because we
Right.
can't. I wish we could streamline it better. I wish I had an opportunity to do what you're doing.
Well, we have a
That
very, but we can't do it for everything, right? So, we've been very fortunate in where we've been able to make allergy care, I believe, affordable in a cash pay manner. But I mean, I can't do that for thyroidectomy. I can't do that for ear surgery. I can't do it for tonsillectomy. I mean, and it's funny because like, certainly me and a lot of my colleagues, we love this sort of cash pay or direct pay patient model. I have not figured out how to do that for surgery. So we still take insurance in our physical office. If you have a head and neck cancer, I just don't know how I can't think of a way that we could charge you. And I don't want to be putting you in a position to have to pay for that. So we take insurance and we deal with your insurance company and, we jump through the hoops. But I think for
Sure.
this one problem, it's been really cool for us to find a streamlined solution for patients.
I need to add one more spicy thing because I just can't
Yeah.
help myself. Okay, you might get mad at me, Dr. Shaw, but I want our
Uh-oh.
listeners to start barking up the ears of their insurance company
Yeah.
that if their kids or themselves need tonsillectomies or adenoidectomies, that the insurance companies need to freaking pay better for
Oh
the
my
ENT
gosh.
because you
Yeah.
guys get paid
Oh, you're bringing this
nothing,
up.
like 200
Yeah.
bucks for it as like a
Yeah.
massive
It's
surgical
like,
procedure.
yeah,
It's
it's like 150 to
ridiculous.
$220.
That's
Yeah. So,
insane for a life-altering
yeah.
opportunity. So of
So one
course,
of one of the things I think people are going to see, and it's frustrating, is like ENTs in the general population are sort of disincentivized to do tonsillectomy, and so we have a lot of parents, and we still do them, but even then we talk to parents. We're like, hey, do you really want to do it? And part of the reason it's so frustrating is the insurance companies pay so little for that surgery that it's sort of like risky for a doctor. You're like, man, I'm gonna do the surgery for an hour. I'm about to go do one, you guys, in like 40 minutes. But it's gonna take me, it's an hour of my time, and and then there's a risk, like if something happens, there's malpractice risk, there's a whole thing, that it just like economically doesn't really make sense for ENTs to do it. So you're starting to see in a lot of communities where the private practice doctors just won't do it. They'll send it to the university and the patients can go to the university and sometimes the university physicians can do it. But even in our call group here in Denver, we have a lot of doctors who are like, it's just not worth it. Like, why would I take on that risk for it? Now, we still want to do it because it's like, it's the right thing for patients. But I also understand the argument from some of my colleagues that's like, the insurance companies have made it not feasible for us. So yeah, that is a
I understand
wild thing to
both
me.
sides of that. I do, and that's why I want like the only way that's going to change is if people, our patients, the people that suffer, start getting mad enough to talk to their insurance company
Insurance
that
company, yeah.
you need to pay out because I understand both sides of it too. I mean,
Yeah.
doctors cannot just do free treatment. There are
Right.
bills you have to pay. It
Yeah.
is your time, and you're
Oh,
using that as a labor of love, in my opinion.
the,
A
the
hundred
reason I'm
bucks.
the reason I'm like not super optimistic about that though is if you talk to my pediatrician colleagues, insurance companies characteristically will reimburse for things that older patients who have the voice and the ability to bother them can complain about. But if you talk to pediatricians, you find that pediatrics is just incredibly low reimbursed too. I mean, everything for kids is reimbursed poorly, and it's because kids don't have a vote and they don't have the ability to call and like complain. It's like very sad. And so, I mean, we're finding this in our communities where it's hard to find pediatricians who take insurance now because they either have to be cash or they can't afford to give good care.
That's
Yeah,
just
our healthcare system is it's working exactly the way it was designed to work, and that may not be have it may not have been designed for you and me as patients.
right.
One point about that, and we'll need to kind of wrap this up.
Yeah, sorry, I
I
got to run too. Yeah,
graduated from
We
dental
can keep
school in
going.
19, yeah, I graduated from dental school in 1972. Reimbursement was for a regular insurance was $1,000, and for the top quality was 1,500. And today it's exactly the same after 50 some odd years.
yeah, I know. Isn't that wild? The codes don't change and the rates don't change. Um, yeah, so I'm sure the 220 or whatever they pay for tonsillectomy was fine in 1975, but it probably hasn't been updated. Guys, this is such a pleasure. It's so much fun. I'm Mac and Pam. I'm gonna text you guys sidebar because I'd love to try to in the early spring if you guys have any conferences locally, maybe not in
I
Japan.
do
I'd love
have
to
an
come.
idea for you. We'll talk about it
Yeah,
later.
yeah.
Let's
And
wrap
then
it
I'm
up.
gonna use yeah, and then I am gonna use this as I do think my company will pay me to come home and see my family and then come visit you. So that'll be great. We're gonna try to set that up.
It'd be great to
Sounds
see.
fantastic. Sounds
All
great.
right.
All right, fellas. You guys have a
Appreciate you guys.
okay. Thank you
Take
so
care.
much for coming today.
Yeah, thanks. Bye.
Bye, Dr. Shah.